Hey guys, my name is Lauren and I will be filming a series of videos on this channel discussing chronic UTI or very difficult to treat UTI. So if that sounds good to you, please stick around. Firstly, if you are going through that or feel like you have had chronic UTI or a UTI that just keeps coming back, a recurrent UTI, I'm very sorry and I do hope you get treatment very, very soon. But you're in good company, so take heart. So it is actually pretty common, and I just feel like there needs to be more information brought to light on that topic, so please stay tuned. I want to preface by saying I am not a health professional. I am a goober on the web, just like a lot of people. I don't have any kind of medical authority. I am not a nurse or doctor or urologist or any kind of health specialist. I work in nutrition counseling. So, and I also want to say that I do not denounce the opinions or professional nature of our doctors and medical practitioners. I do not want this to be a place where, excuse me, we bash doctors or say they're all quacks or anything like that. I have great doctors and I'm very respectful of their expertise and I'm very appreciative of their care. So let's just keep it positive and just move forward and help each other. So, excuse me, and I'm getting over a chest cold, so I'm trying not to clear my throat too much. But I had a total abdominal hysterectomy about 8 months ago, and therein, that surgery, I did have injury to the bladder where I was sent home with a Foley catheter indwelling. I have 3 other videos on this same channel if you have information you are needing on that. If you have any questions on that, what that's like, it is not fun, but I do have 3 other videos on that. So just some things that I came across, things that helped me. So at that point when I had the catheter, it is sent home, I did everything I could to keep it clean and be very hygienic. I showered, of course, frequently, and did everything I could to stave off a UTI. And I got one anyway. So since that time, excuse me, in 8 months, I have had pretty much recurring UTIs. I don't know if it is the same exact UTI. I know for sure it is the same bacteria. It has been E. coli since day one. And I have been to my primary care and urgent care providers about 6 times at least in that time. I have been prescribed also just about everything. All of the normal standard, I don't know if they're like the standard UTI antibiotics, but I've been pretty much on nearly all of them. I have followed them to a T. I took them as prescribed. I did not discontinue treatment. I did exactly as the doctor ordered, and usually within 2 to 3 weeks, the UTI symptoms would return full blown. So basically, this went on, and I thought, okay, I can go to urgent care, or I can message my doctor over and over and over again, and I'm really going in a circle here. I'm not advancing. I'm not getting any better. So I was doing my own research, and I said, I think I need like an infection specialist or a urologist, someone that specializes in this, because I know our primary care doctors are great, but this is not their expertise or scope of practice. If they are general practitioners, they may not have a full understanding of this other than diagnose what's wrong, prescribe something, and move on. But that has not been working for me. So about 2 months ago, I asked for a referral from my general practitioner for a urologist. I have met with him twice, and I'll go into that here probably in future videos. This first video, I just wanted to give that little backstory, and if you're going through something like this, I'm hoping that the next few videos will be of use to you. This is not a fashion or beauty channel. I look terrible. I am aware. my lighting is terrible. I'm hoping the audio is okay. This is just for spreading information and just sharing what has worked and what has not. So in this time of taking all these different prescription antibiotics, my body has suffered a lot. And the UTI just keeps coming back. So I just finished the last course of antibiotics about 12 days ago. UTI symptoms came back about 2 days ago. So it's usually within that 10-day window of time that UTI symptoms will return. my urine does become very cloudy. There's a smell to the urine, and all the wonderful UTI symptoms, you know, the pain and the urgency and just absolutely horrible. But that's all returned. So I just wanted to come on here again and just say it's so important to advocate for yourself and for your health. If you are hitting that proverbial wall of talking to the doctor and they're like, let's just try this prescription, let's try this antibiotic, let's take this twice a day, let's take this after whatever, prophylactically, we'll get into that too. Please reach out to your doctor and tell them this has gone on for a very long time, and although I am very appreciative of what you've done for me, I really need to get on with my life and get on with treatment because I have tried everything. You don't have to refuse it. You know, the medications, I still filled the prescriptions, but a lot of them I still have in my drawer. I told my doctor I can't stomach the prescriptions anymore. The antibiotics, I can't. They have riddled my body. It's like sending your immune system to war and hoping it comes back. I mean, antibiotics are, you know, you're taking a drug that is intended to kill the bacteria with doing as minimal harm to the remaining part of your body as possible. And it usually is a short course of treatment. Today, my urologist told me that he wants me to be on macrobid, which is nitrofurantoin, for the next 3 months. And at this point, you know, driving home, I thought, do I really want to go through all this again? Is it worth it? And you end up kind of, you know, weighing it like, okay, is it worth it? Should I go through with it? Should I do what the doctor has told me to do? Are there options? Excuse me. And that's the other thing I want to encourage you to do is, firstly, advocate for yourself, ask for that referral. If you've gone through that, you know, several times, you're like, this is not getting better. I've never had this happen before. There's definitely something going on. Get that referral. Get in to see a specialist. The second thing is to communicate with your doctor, of course, in a very professional way. I have kept a very open, you know, professional message to my doctors. Each time I message them, I'm like, hey, thank you so much, but I have taken that 4 times and it failed. So what other options do I have? And on that topic, that's another thing I want to recommend is talk with your doctor, and eventually, if you do get a specialist, a urologist, talk to them about other options. Sometimes they have to do their diagnostic kind of procedures, their cystoscopies and cystograms and different things. They may need to do these for diagnostic purposes, but when it comes to creating a plan of treatment, if you are not satisfied with that treatment, you do not have to submit to it. I don't believe in going rogue and forfeiting your health, maybe potentially even further, because there's no way to know how severe your infection is and what the bacteria that's afflicting your body is. But like today, for example, I saw my urologist. I knew that my urine was already getting kind of yucky. It was infected and cloudy. Even though I wasn't there for any other purpose other than getting the cystoscopy, I wanted to submit a clean, fresh urine sample. I said, you know, I haven't taken any azo, I haven't taken any antibiotics, so what is in my urine is alive and virulent and taking over. So that way they can culture that, and I think that would help them moving forward. Sometimes you have to think a little bit ahead of the doctors too, and that's my biggest thing too, is to work with your providers. Even though I have been at wit's end with my healthcare plan the last 8-9 months, I'm still very appreciative of my providers and very respectful. I feel like also if you are always maintaining that decorum of professionalism and gratitude and working with them, doing what they ask, doing what they say, but also professionally voicing your concerns, like, hey doctor, you know what, that's a great plan, but what are my options? What are my other options? Do you think I should get another opinion? Do you think there's someone else I should see? I think that's really, really important to get to the root cause of what's causing the infection. So that is where I'm at this point. I'm on the fence on going through with the 3-month treatment plan of taking macrobid every single night for the next 3 months, or continuing with homeopathic options, which I want to get to the next video, and I want to talk about those. There are several that are pretty common knowledge and on the internet, but there are a few things I'm researching too, just to see if maybe it would help, because I'm trying to get my immune system back as well. We're going into cold and flu season, and I really need that microbiome in my gut to be full force, strong and ready, because I do work with the public and I work in the health sector, and I need to be able to work and be effective at my work. So again, if you are going through UTI symptoms, I'm hoping you get relief very soon, but if you do feel like it is turning into a chronic, long-term, ongoing situation, you're like, okay, this is antibiotic number 3, I still feel like crap. Stay tuned, because that's exactly what we'll be talking about here. I want to go forward with the rest of my videos in a more organized fashion and have a few topics I discuss in each one and not ramble cafeteria style like I am today. So anyways, I want to thank you very much for watching, and please stay tuned. Again, we talk about health things. If you're not squeamish, then you're in good company. So thank you so much for watching. Stay tuned, and I'll see you in the next one.